In the previous video, we discussed about what is hair loss and what is hair fall. So we have now established that when the hair is falling and becoming weak, you can try to preserve it. But once it goes from the root, there is no other option but to do a hair transplant. I am Dr. Desai, a practicing plastic surgeon, board certified cosmetic and plastic, and a hair transplant surgeon, practicing for over 20 years now with a lot of experience. I'm going to be talking about the different methods of hair transplants and the benefits and try to explain you in brief what is hair transplant about. What is transplant basically? Hair transplant. We simply take hair from the back and the sides or the body and transplant it to the balding areas. Why do we take hair from the back and the sides and the body? Because this is the area where the hair is genetically stronger. Genetically, it is predetermined not to fall or to go last. Hence, we take hair from these areas which tend to lose hair last or don't lose hair at all, and we transplant it to the balding areas. That is the procedure of hair transplant. Originally, it was done by a strip method where a huge piece of skin along with the hair, scalp was cut and stitched up, the gap was stitched up. So it used to, and then one single hair follicle used to be cut from that and put in the balding areas. That was called the strip method or the FUE method. The advantage of FUE, in one day you could get more grafts, but it left scars, more pain, more recovery time, bleeding, chance of infection, stitches, and longer recovery. Then came the FUE method. FUE method is where you take single hair follicle with punches and then transplant them in the balding areas. So there is no cuts, there is no scar, there is no stitches. The chance of bleeding is less, the chance of infection is less. Then what we do today, it is basically FUE but an advanced form of FUE with certain modifications. It is called as a DHI technique. It is not actually a technique or a method, but it is a process. It is a whole SOP which we have designed, and we follow this to make the results even better or make hair transplant more successful. So what are the various steps that we do in this advanced FUE or the DHI technique? Number one, when we are removing the hair from the back of the head, we remove with manual punches, not motors. Manual sharp punches make sure that each hair follicle is removed precisely with tiny holes which heal faster, which bleed less and have less scarring, less visible scarring. Okay? What does a motor do? It actually rotates on the scalp skin. It rotates. Once it rotates, it creates heat, it creates friction, which is not good for the survival of the hair follicle. The hair follicle can get twisted because of that. Also, when the motor rotates on the surface, even if the punch is 1 millimeter, the hole will be larger because it rotates. It will be around 1.2 or 1.3 millimeter. But when you take with a sharp instrument, a manual punch, if it's 1 millimeter, it will be exactly 1 millimeter. There will be no torsion, no friction, no heat creation. The grafts will not they will not be destroyed. The survival will be better, and the scar size and the hole size is smaller. So bleeding is less, healing is better. The other advantage, what people don't realize, is that if you want to reoperate and take grafts again from the same area, because there's less scarring, it's easier to take. If there is more scarring and bigger holes, it makes it more difficult to operate on the same area. So hence, manual extraction, what we do, has these big advantages of less scarring, less bleeding, faster recovery, and better harvest, better graft survival in subsequent hair transplants which are required. Now, second step, what we do different is we implant with implanters, sharp implanters directly. We don't make holes, we don't hold hair with the forceps and put it in. There's no handling of the grafts. It is directly loaded into a pen-shaped device called the implanter and implanted inside. The implanter itself is sharp, it makes a hole and plunges the hair inside. So the depth, direction, angle is perfect. Okay, you don't have to catch the hair. When you catch the hair and put it in, it can get destroyed. The hair follicle can actually get damaged. They can be lost. The survival will reduce. Then if you are trying to put it, it may not go in the perfect depth, direction and angle. So the hair will grow a little bit haywire. It won't grow perfectly. So these big advantages make the implantation better the survival better, and even the depth direction angle is so perfect that it looks very, very natural. So this is what the advantages of our advanced technique is. So manual extraction with one-step implantation of sharp implanters gives a better yield, better graft survival, better density, and a far more natural looking result than you get with other techniques. Hence, this is of a big advantage. Who's the right candidate for a hair transplant? Medically fit, good dough in an area, good hair in the back, less number of telogen or dying or resting face hair, somebody who has a lot of body hair if you want to use body hair, somebody who doesn't have any kind of scalp infections, medically fit, no hypertension or well controlled hypertension. So all these factors must be taken into consideration before you do a transplant. Okay. Number two, psychologically and socially motivated patient. What do I mean by this? If a patient himself is not ready for a hair transplant or is getting it done because of pressure, he will not do aftercare properly. Hence, the patient should be motivated actively. Third, if the patient has a small area to transplant and other hair which is falling, the patient should first take medical therapy, get stabilized with hair fall, and then do. You don't plant trees when there are trees already dying in that area. What you actually do is make the soil proper, preserve those trees, make sure that they are fine and healthy, and then go and plant new trees. Exactly with hair. If somebody comes to you with lots and lots of hair fall and having a very poor quality of hair, then you first start medications, stabilize him, make sure that the hair fall reduces, hair health and quality improve, and then do transplant in the bald areas. So this is something which you should keep in mind. Plan a hair transplant not looking at 2 years and 3 years. Plan for a hair transplant looking at another 20 or 30 years. So that is important when you plan a hair transplant. Do comment, do like, do share this video, and please educate everybody. There is a lot of myths, there is a lot of things, misunderstandings about hair loss and hair transplant. Please share this video so that the people are educated in the right way. If you want to know more, please do visit our website or call us and book an appointment. Thank you so much.